Let me introduce you to Adam Phillips. Adam's been with the company for as long as he's known life, almost. Adam has grown up in the family of Patrick Phillips, and he has taken over the helm here at American Business Systems over the last few years. And it's good to have Adam on here. So, Adam, you and I are going to be running the show today here on the webinar. So it's good to have you here, Adam.
Hey, thanks, Eric. Thanks for inviting me. I know you've got a lot of exciting things to talk about today, and I'm glad to be able to kind of discuss everything with you. And just a reminder, everybody, if you see that question box over there on the right, anytime during this webinar, if you think of something that you'd like to know about the healthcare industry or just kind of starting your own business or any kind of question at all, feel free to type it in there, and we'll get to the questions as they come in.
Yeah, speaking of things that are going on in the healthcare, one of the things that we all do here, I mean, we talk to you folks that are on the webinar today, but behind the scenes, the whole team back behind here, we're always researching information about what's going on in the healthcare industry, and Adam sent this to me last week. It's from Medical Economics. Folks, take Adam and my suggestion here. If you're looking to get into medical billing, sign up for these. You can go on there, you can sign up and get these emails that come from Medical Economics and some other places that we're going to show you today. But Adam, this is so interesting because we've talked just very briefly so far about the new codes that are coming up. Now, this ICD thing that we're talking about here, this is what's considered the diagnosis code, basically what's wrong with the patient. And why don't you explain to everybody what's happening here from going from an ICD-9 to an ICD-10?
Yeah, Eric, this is the beauty of being a part of a company like American Business Systems, where we are staying on top of changes in the industry, and we are, not only continuing to educate our licensees, and that's something that you get when you become a part of the ABS family. Is you get ongoing, continuing education for the life of your business that never expires. We're always there to inform you of what's going on, to kind of help you, as you're running your business. But yeah, one of the big things that's happening right now is the big switch for what they call the ICD codes. These are the medical codes that doctors use to submit to insurance companies to get paid. And there's going to be a very large changeover happening. It's going from version 9 to version 10. And as you can see on this little report right here that we found, 62% are still reporting that no, they are not ready for the changeover. You know what that means? That means there's going to be a ton of doctors that are losing a ton of money come October 1st when that switch happens because they're using the wrong codes. So our licensees, just by using the technology that we'll be showing you in a little while here, just by using the technology, they're going to be able to help doctors get paid on those new codes. And we're going to kind of explain how all that works here in just a minute.
Absolutely. And then not only do we see that, but you can see here as we're kind of just scrolling through these next few slides here, I mean, some of the reasons why they're not ready. I mean, everything from staff buy-in to, they anticipate a further delay, or software vendors are not ready. Folks, this is giving you an incredible position to get started in a business like this. And you've heard Patrick say, you've heard Adam say, you've heard Jason and all of us say here so far here at American Business Systems, whether we're showing you how to get your business started in medical billing or you're getting your business started in some other field, you need to know what's going on, what the trends are going on. And there's such a trend right now that doctors are needing help with, and you can see just by this, what is your biggest concern regarding the ICD transition? And it's all broken down, but you can see here basically all of the above, 67%. They are just in fear of what's about to happen. Now, what we're able to do, and what we're going to show you here, again, that's going to help you separate yourself from the competition, you're going to see why, as Adam just said, you'll be able to be prepared right after the training workshop to go out there and give this information to the doctors and sometimes get your first client just by what we're about to share with you today. So as we're kind of rolling through these slides now and kind of getting into the meat of the webinar, I know that we all get asked about competition, and that is sort of a broad question whenever we talk about it, because I like to kind of drill it down. You talk about competition with us, about American Business Systems, or you talk about the competition that's out there in the marketplace for you as a licensee. Let's kind of discuss what, some of the things about competition out there in the marketplace for medical billing.
Yeah, we get that question a lot. And, I like to answer it this way. There's a lot of money that can be made in the medical billing industry if you know what you're doing. And that's a key point, because there are a lot of people that try to get involved in medical billing on their own. And, you certainly can do it. I mean, there are people that have done it. You can take a course, on medical billing. You can research software. There's dozens of different software vendors. You can come up with your own marketing materials. But what usually ends up happening is when it comes down to actually getting your foot in the door and finding out how to, gain 5 minutes of a doctor's time to kind of show them what we can do, that's the hard part. And so that's what we've really perfected. American Business Systems has a very specific process of educating the doctors and letting them know, first of all, that they're having issues with their billing, and a lot of them are spending a lot of time and money, and they don't even realize that they could save money by outsourcing some of the stuff that they're doing. So yeah, I mean, that's just a part of it. Is a lot of people that you're going to be competing with are what we call the mom and pop billing companies, which is a lot of people working from home. And the thing is, though, is the big difference is a lot of those mom and pop companies, you can tell right away what kind of operation they're running, and it's not much of a competition because our licensees have so many different services and solutions. They do a lot more than just medical billing, so there's a lot more to it that our licensees can help with versus the other mom and pops.
Yeah, and I know that usually our first thoughts as we're talking about through this is, I think, people that are on the call today. Now, I'm going to start picking on some folks here. So I know that, Isaac, you've been on here quite some time, and we're glad that you're here. And I know that probably one of the thoughts that you've had here is, what about the competition? Where's my market out there? And, what does it look like? And Adam, I know that we could probably go on a Google search and try to say, wow, what are other medical billing companies around me? Well, I like to kind of divide that into two questions, or basically two answers. First of all, don't worry about those that are around you, because your territory is not just your little area. Your area can be as big as the United States is. So whether you have a billing company that's next door to you or not, Adam, our software gives people the opportunity to have clients in all states.
That's right. Yeah, I mean, the thing is, you have to realize, if you look at what our licensees are currently earning, per client, they're charging in the neighborhood of around 5 to 9% of all the money that the doctor gets from insurance companies. So, I mean, really, it takes just a handful of clients to make a decent living at this. I'm talking about, close to a 6-figure income with just a handful of clients. So that's the other factor, is the number of clients that you need is probably smaller than you might think. And also the fact that, like you mentioned, there are no territorial restrictions. This is not a franchise. So you could have clients in any part of the country, as well as, our system is web-based. And again, we're going to show you that here in a second. But that means the whole transaction is completely paperless. And so you could easily have clients that are out of state, and it's not a big deal.
Yeah. The thought that we get, and the things that we get hit up a lot about what about these other billing softwares? And I think a lot of people start thinking about, okay, well, this has to be my other competition. So what Adam and I are talking about right now is the difference between medical billing companies that may be using one of these softwares to do the billing, and then what you think of as the medical billing software. So really, this is not necessarily their competition out there either, because as some of the things that we're going to show you here, that we're going to separate ourselves even from the big boys that you're seeing right here. And as we kind of go through it, we've got to really be thinking about, what is the competition? What does it look like? Well, we like to try to divide it into two sections. Really, you are your own competition. because in your mind you're thinking, "Oh, I don't know if I can make it out there," and you start thinking the world's too big for you. So when we look at it in reality, the two biggest competitors is number one going to be yourself, and then the other one is the doctors. Now, Adam and I are going to kind of take you on a little tour why we say the doctors are actually your biggest competitors. And it's for this very reason. The why is because guess what? Doctors are already doing billing. They're either doing it in-house or they're outsourcing it. Adam, I mean that's what's happening, right? Doctors. I don't think we've come across a doctor who's not doing billing some form or fashion.
Yeah, they've got to get it done one way or another. We've actually found it to be about 50-50 is what I've seen, in-house versus outsourcing. The good news is our licensees are getting business either way. Because, I mean, definitely the ones that are trying to do their billing in their offices, they've got a lot of very high cost in doing that with staff and hardware and software and all this other stuff. But even doctors that are outsourcing right now to billing companies, a lot of them are unhappy with the fact that the company doesn't have the latest technology. You know, they can't get reporting in real time like they can with our system. And they feel like they've kind of lost control. When they see a demonstration of our system, the fact that they can go log in 24/7 and see exactly where their money is at any given moment, they feel a lot more comfortable having someone outside the office doing the actual work.
Yeah, exactly. Adam, Eugene's asking a question here, and he's saying one of his biggest concerns is basically what to charge. He says, especially because I'm in New York City, where percentages are not allowed to be used as a charging base, but rather their fees. What are your thoughts on that?
Well, we do have licensees that are doing really well in New York. And my understanding was that some of them actually are charging a percentage. So I'd have to check with them and see if they're maybe somehow working around that particular rule. I'm not sure. But the thing is what we help you with, Eugene, is every single scenario that you come across, every single potential client. One of the things that ABS does is we help you take a look at, the doctor's current situation and how they're doing their current billing, and we help you come up with a scenario for pricing that's going to be competitive in the market. So we're going to help you figure out, if it does have to be maybe a flat rate per claim, if that's a thing that you have to do, then we can help you with that. Or if we're able to figure out a percentage, we can help you with that as well. So we're going to be there every step of the way and trying to make sure that your proposal is going to make sense for all parties is what I'm trying to say.
Yeah, exactly. And yeah, take advantage of our support because that's what they're there for. Now, talking and thinking, now kind of drilling this down as we're going through today's webinar, and one of the questions that I think I always like to ask myself when we're doing any type of due diligence, and this is what you should be doing. Now we've kind of narrowed it down. We know who the competition really is. This is the doctors. We know that they're doing in-house billing or they're outsourcing. So part of what the things that Adam was alluding to is that you're going to learn how to do what's called a practice analysis. And that's going to kind of really uncover some of the pain points of that doctor. But some of that, those that are on the call today, some of what you're going to see here in this next slide, some of that's already actually been done by a third-party company. Well, that third-party company is called Black Book. Now, obviously, this is the latest information that we had because it was done towards the end of 2014. So we're literally only 6 months old into this information. But what you're going to find, these next couple of slides, so folks, if you're paying attention today and you want to take down some notes, these are some of the notes that Adam and I think that if you're thinking about a takeaway today, this is what you need to take away because we've kind of eliminated that, and we're not dealing really with the mom and pop medical billing companies. That's not necessarily your competition. Neither is it the software companies. We know now it's the doctors. Well, let's uncover and kind of unpack this here as we kind of go through this. So, Adam, as we see here, this study, we're going to go through about 4 slides here, and they're all stats here. And they came back and said that 91% of physicians fear that their outdated and or billing systems that are not integrated to their EHRs. This is going to force them to possibly sell their practice to a larger group or even a hospital, because I know we get that a lot, within the next 12 months, or possibly even close their practice. That's a huge amount of doctors out there that are saying that.
Yeah. And the reason why we're showing you these facts and figures here on these couple of slides is to let you know that there really is a need for the solutions that we have in the market. I mean, we have solutions that are literally taking a doctor and turning their revenue completely around and improving their revenue by, up to 30% or more in some cases, and helping them stay in private practice. I mean, that's a huge deal. Our licensees really are affecting big, the market in a big way, because a lot of doctors are so inundated with all these different rules and regulations now that they're, like it says there, they're retiring early, and they don't want to do that. They want to practice medicine. They like it. They love it. They just don't want to have to deal with the paperwork side of things. So that's what we help.
And Adam, I know that we get to talk with folks all the time, and we hear about, well, what's going to happen if all the doctors just get bought up by hospitals? Now what? What you just heard Adam say is we're trying to keep them from doing that, and the doctors don't want to do that because it's going to hurt them at what they love to do, which is see patients.
Yeah, we've seen a trend in both directions. We've seen that when all this stuff came out with the Affordable Care Act and all these new rules and regulations, doctors did start. Some doctors were shifting to going to work for hospitals, but that means that they turn into an employee. They have set hours, they have set wages, they have to do what the hospital tells them to do. They lose all their private practice patients. So it's not a scenario that they really enjoy. And so we're actually seeing a trend where doctors are leaving hospitals and going back into private practice because they just felt like they were too tightly controlled by the hospital organization.
Exactly.
Yeah.
Then this stat here says 89% of all physician practices agree that their billing and collection system process need upgrading. So you talk about, as we're looking at what's going on, we just showed you some key factors there about the ICD-10s. The doctors aren't really necessarily ready for that. Now they're just saying, in general, their billing and collection system process need upgrading. And that's why we're going to kind of take you through a little bit of that today. Then 21% are considering an upgrade of their RCM. Now that's revenue cycle management. That's what we're going to show you here. Ours is called iClaim, so we're going to show that to you. 21% are looking to do that within 12 to 6 months, and then 88% are looking to upgrade within 6 months. So again, folks, if you understand where this is coming from, this is towards the end of last year, going into this year, and this is going to be a trend for the rest of this year. So you've got a great opportunity. And the last one, which I think is one of the most important ones here, Adam, 42% of all small physician practices. Now that's small practices are including 1 to 5 doctors. That's what that's there for. With employed billing staffs, hope to outsource their billing within 12 months. That's a huge number there, Adam.
Yeah, if that's not third-party validation on the validity of this industry, I don't know what else is. And we can send you guys links to those rankings if you want to see them yourself. I mean, they're out there. So
yeah. And so, folks, what we've been able to do is just, again, all the way up to this point is we've set the table to kind of explain where the problem lies and what some of the things are now. Now we're going to show you how we can help you separate yourselves from the competition and really, Adam, really have no competition. It's hard to say that and be that bold about it, but I feel so that's the way I feel about our system. It just truly leaves the competition behind.
Well, I want to bring it back around to, the email that we sent out for this particular webinar was about not having to sell anything, and really kind of going full circle here. The technology that we're going to show you is a part of the process of educating the doctors and consulting with them. So Eric mentioned a little bit earlier about the first part of the process, which is doing a needs analysis that we show you how to do. So you're able to consult with an office manager or a doctor and say, look, I'm not going to talk about any particular service. I'm not going to talk about any particular fees until we both have a clear picture as to what's going on in your practice right now. So the first part of that, the process is doing that needs analysis that we show you how to do. And then now we're going to get into the second part of the process, which is we actually do a full demonstration of this platform on your behalf, as if we're a part of your company that you set up.
That's perfect because again, it blends both what we set out to say about how to start this business without having to sell, and then how to have no competition. I mean, this is the differentiator here, folks. Is that I don't think you're going to find anybody else that's going to do what we do for you to help you get your clientele, get your doctors, and it all starts off with our iClaim platform. Adam, let's talk real briefly what iClaim is. I think some people just think it's just a billing system, but it's really more than that. It's what's called a practice management system. Can you explain to everybody what this really means about the iClaim practice management system?
Okay, so this system is what is going to, just by you using this system for your doctors that we help you sign up, it's going to make you the hero with the doctors, with regards to the doctor's revenue in several different ways. But the reason why is because this system that we have is fully web-based, which means all you do is access it on the internet. So you can use any device that's connected to the internet, Mac, PC, iPad, whatever. So it has a completely integrated billing platform that you're looking at here, and then the EMRX side is the electronic health records that the doctors will be using on their side. And so we'll show you how all that works together. But this is just by using this system, you are literally going to be able to reduce the doctor's claim rejections. A lot of their claims get rejected just because they have older software that hasn't been updated with all the new rules and regulations. But with this system, since it's web-based, we do all the updates for you every night. So every morning when you log into this system, you have the latest, greatest version of everything to do with billing. If the government says, well, now you got to file a claim this way. Well, we've already made that change for you. So you as a licensee don't have to, you don't have to worry about staying on top of all the updates.
Yeah. And another thing what Adam was talking about there is not only do we have the new updates, but again, he mentioned something just a moment ago about how we can help reduce some of the issues that the doctors are faced with. And this web-based platform is going to give the doctors an added bonus. And I like to talk about the added bonus because Adam and I were talking about this earlier today. We actually found, and we might bring it up in another session up here in the next couple of weeks, but we found a statistic showing that 40% of claims that are rejected, 40 to 50% of claims that are rejected because they have the wrong patient information into the system. Now, let that kind of sink in a little bit, because if a lot of people ask, well, what are we going to have to do? We're going to have to change what the doctors are currently using with their system and use ours? The answer is yes, because the answer could be the problem. One of their biggest problems could be with what they have in their current system. They could have wrong patient demographics in there. And if you start off with wrong patients' names and addresses and their phone numbers, that claim is going to get rejected because the insurance company doesn't recognize that patient with that information. So, folks, if you understand anything right now, revenue cycle management begins right where Adam and I are going to show you, and that is making sure you get the right patient information in here. Now, we know, Adam and I know, this is where we really separate ourselves from everybody else, from other medical billing companies and other medical billing platforms. So this is what we want to start off with, because this is our favorite part of it. So we want to make sure that we get that in there. And the way that we do that, we can come over here and do right here what's called an eligibility request. What this will do, this is going to pull up this information here to where we can go right into this screen right here, and we can put in who the payer is going to be of that particular patient, whether it's Aetna, United Healthcare, Medicare, and then put their subscriber ID or their insurance card ID, and then click on Look Up. And what happens here, that information now comes directly into the system. Now, Adam, this is great because now we just get to see some information about this, but I'm going to kind of let you take it from here whenever we click on this thing called Create Chart. I mean, explain what happens at that point.
Yeah, so this is, and we can give you guys a full, personalized demo, a live demo of the system if you want. Just contact your ABS rep and we can do that. But this is very important because this feature is I haven't seen any other technology that has this particular feature. So all this feedback comes back from the insurance company almost instantaneously, the stuff that you're looking at on the screen. So every piece of information regarding the patient that you would ever want to know about. So at the click of a button, you can click the Create Chart button, and then it will actually create an entire patient record based on the information that came back from the insurance company. Now that's a very big deal because the insurance company only cares about the information that they have on file. They don't, if the patient maybe moved to a new address, it doesn't matter. Whatever the insurance company has on file is what they're going to base their, the payment of the claim on. So this is a very neat feature, and it's just one of several key features that we have that are designed specifically to improve a doctor's revenue and make sure they're not wasting time on a patient where they may not get paid on.
Adam, I did a demo for someone last night, and like Adam said, just give us a call. We'll be happy to show this to you. And this is somebody that Sarah was working with, and this lady has been a biller for several years. I showed this one portion of it to her. She goes, I cannot believe how much time that's going to save our office and the offices that she's doing billing for, and reduce the patient claims that are going out from being rejected. Mm-hmm. Now, folks, again, kind of let that sink in because, again, like I mentioned earlier, this is where revenue cycle management begins. And what we're able to show you right here, and I'm going to let Adam talk about this too as well, but this is one of the favorite things we like to show. Now, Adam, we can show the demo to those that are on the call today, but explain how this is the same type of things we do whenever we're doing this for our licensees for their potential doctors.
So we're talking about what now?
The demos that we do for our licensees.
Yeah, the demos. So a big part of our support that we provide you for the life of your business is the step that I mentioned where we actually do a full demonstration, a full live demonstration of the iClaim and the EMRX system. So remember, we're not a franchise, so you guys are actually setting up your own company entities. And when you tell a doctor, hey, let me schedule a demo with my demo team, that's us, that's ABS. So we actually do the demo for your clients as if we're a part of your company. And the neat thing is you do that needs analysis for them first and send that to our demo team, and we're able to do a tailored demo specifically touching on the different points that we see in the needs analysis so that they're the most impressed by the system. So so we're answering all their technical questions. I mean, you literally have to know nothing about this system, and we are doing the demo for you and answering all their technical questions. So obviously that's going to build your credibility. The doctors are going to see that you're a part of a big network of technology partners, and really it's a good deal for everybody.
Yeah, and so hopefully here we are close to the bottom of the hour, a little bit past it. And hopefully we've been able to show you how you're going to be able to separate yourself from the competition, and really how there's not a whole lot of selling that goes into this either. Now, the other part of what we do is show the doctors the EMRX side of everything. Now, this is the electronic medical record side of this, and we go through this in full detail with them as well. And the reason we're showing you a couple of things here, we're not going to spend a lot of time on this simply because this is the doctor's interface. What we were looking at first with the iClaim system, that's more of your interface and that front office staff's interface. That's what they're working through. Now on the doctor's side, again, they're dealing with on the EMRX side of everything. So we're showing this to you for a couple of reasons. For those that again that are in the know, you know what's going on with the ICD-9 conversion from 9 to 10. We wanted to show you that we've got those in here already, and we'll show this a little bit bigger position right here. So you can truly see that we've already got all the ICD-10 codes in here. We can display it in this format. So again, folks, we are well ahead of the game whenever it comes down to what's going on in the medical billing field, which includes both the revenue cycle management portion of it and what the doctors have to do when they're going through it. And so that's where this seamless integration is coming from. We're not talking about 3 or 4 different entities here or technologies here. We're talking about one technology that has all of this involved into it. And one of the other things I like to share about these other, what we consider to be the big boys out there in the field on the medical billing systems is we like to ask the question and want to pose the question to you, what do these billing services not have involved? And again, this is another area where you can feel confident about going out there and marketing this business without having to sell it and show something that none of these other companies have. And that's what's called the clearinghouse. Now, Adam is going to kind of take us through a little bit of a discussion about what a clearinghouse really is, and then we're going to show you exactly why, why it's important to have it into the system, directly into your system, like we have with iClaim. Adam, talk just real quickly about, just a quick overview about a clearinghouse in general.
Yeah, I don't want to get too technical on everybody on the call, but basically a clearinghouse, in layman's terms, every insurance company wants to receive a claim in a slightly different format. So basically, a clearinghouse will look at a claim and see what particular insurance company that the claim is needing to be sent to. It will do the automatic reformatting for you, and then there's several other things that it does in helping the billing software and the insurance company communicate properly. The thing is that virtually every other technology out there is using a third-party clearinghouse. And so you've got different companies that are trying to piece their systems together and get them to talk to each other. So it's not near as seamless as our system because we actually are the clearinghouse. We provide that functionality that was built in-house under one roof along with the billing platform. So we're able to much more efficiently, transmit and receive all the pertinent information.
Yep. So let's kind of talk about it just real quickly. And Adam's already talked about, what a clearinghouse does. Ours goes directly, if you can imagine, it's going directly to the insurance payers. Now, what this does, this gives us a huge advantage because if you just really think about it, folks, we're actually at this point processing claims in real time. Now, the reason we were able to pull that patient demographics earlier on, as we showed you, is because of our clearinghouse. No other system can do what we just demonstrated to you just a moment ago. And then as our claims go through and pass through our clearinghouse, it allows us to proceed directly, again, to the payers. And I'd like to talk about this last little section here. Folks, this is your unique difference between you and other medical billing services. Simply because, number one, it's integrated into the system, and it will help you lower that doctor's rejections and expedite their reimbursements. Adam, I was talking with the licensee just a couple of weeks ago, and they just converted one of their doctors over to the iClaim system using the in-house clearinghouse that's built inside of iClaim. And the doctor was normally getting paid within 35, 40 days. And this doctor was so shocked to know that the licensee was not lying to them that in about 7 to 10 days that doctor was going to get paid. So what happened is that the doctor saw a patient on Wednesday using United Healthcare. They got processed that night. 5 business days later, Thursday, Friday, skip Saturday and Sunday because those aren't business days, Monday, Tuesday, Wednesday, the doctor had a payment in his bank account on Thursday the next week. That's the expedited reimbursements that we're talking about here, folks. Yeah. This is separating you far from the competition. All right, so let's keep going on here. And the last little piece that we want to talk about here is actually our new updated patient portal. This is too cool to go into too much right now. So again, folks, if you want to get a demo of this, just ask your ABS rep, and we'll kind of take you through this. But Adam, this is so cool that you or I or anybody else that is going to go see a doctor can usually can check in to their appointment and go through all that paperwork online before I even leave home and have all of that at the doctor's office. That's another integrated piece of the system. I'm just going to show a couple of screenshots here, Adam, but you kind of talk a little bit about the importance of the patient portal, that how it's even helping the doctors even go to be better at what they're doing.
Yeah, there are so many neat features with our patient portal. I mean, you guys have to realize there's so many doctors using systems that have nothing, no patient portal at all. And what ours has is it has the ability for patients to go and check their past medical history. They can download their entire medical records. They can schedule new appointments. They can see their prescription history. Not only that, but they can actually get pay their bill. They can get an email that says, "Hey, you have a bill. Your bill. Click here to review it and pay." And they can pay their current charges, request prescription refills. And I haven't even talked about the telemedicine aspect of this system, which I don't know if you're going to get into that, but you guys may want to do some research on telemedicine. That's the next big up and coming technology that systems are adding to their portfolio, is the ability for doctors to make a complete visit with a patient over the web with a webcam. And they actually can bill for that in some states. It's not available in all states, but they can bill for it and get paid on doing that instead of having the patient come in to the office physically. So, that's obviously very helpful in places like rural areas, and also, maybe urban areas where doctors are just so busy with patients coming in that they can, see some other patients on the side on the webcam.
Adam, it's interesting that you said that. Today I was watching our local Fox News, and they're here in Texas. The Texas Children's Medical Center is actually talking about how they're seeing patients, because a lot of their patients come in from all over the place. And so to do a follow-up, that's what they're doing. They're doing telemedicine now with Texas Children's Hospital there in Dallas. And so here you got a huge medical hospital. I mean, Texas Children's Medical Hospital is huge. Imagine giving that same power to a local physician. This is the power of what we're bringing to your doctors in your area, a telemedicine platform built inside of the patient portal that will give the doctors that opportunity. Now, Wilfredo, you asked a question, how does this software help improve meaningful and HEDIS reimbursements? Well, it's what we're just showing you. What we're showing you right now, this is the only system that we've ever found and that we know that has everything in it to improve any of these reimbursements for these doctors. Everything from the clearinghouse to the iClaim to the EMRX to the patient portal, all of this is working in harmony to help those doctors get reimbursed. So if you see this here as just a complete seamless integration, this is where, again, our advantage comes into the marketplace. Now, what we want to do right now in this next little slide, we're just going to kind of show you and demonstrate to you as this next little slide builds. So let's kind of just follow along with what's going on here. And you can see no paper is involved in this. So the patients start off at their home, Adam. They can get on their iPad or their laptops or whatever at home. They can go in and put in here and get all of their appointment stuff set up, and then from there it goes directly to the doctor, directly into the EMRX software. I don't know, but Adam, you got children and you go to the doctor and you or your wife have to sit there and write out all that paperwork before your kids are seen at the doctor's office. I mean, can you imagine having all that done before you get to the doctor?
That would be really helpful. Yeah, I mean, almost every doctor that I have visited for myself or for my family is you show up and they give you this giant clipboard full of all this paperwork that you have to just hand write, and it takes forever.
Yeah. So this is what we're trying to show you here, is how already automatically we're showing you how we can help separate you from the competition. Then when the doctor sees the patient, all of that information from there goes directly into iClaim for you as the medical billing company to actually process the claims. Again, you can see built inside of there is the clearinghouse. So that's going to give you direct connections now to the payers themselves. And that way, this is where you're able to get this doctor reimbursed as quickly as possible. So this is the seamless situation from start to finish, patient, doctor, billing company, insurance company. The only thing that we don't have on here is being paid back from the insurance companies back to the doctor. And so this is incredible to help you. We're doing our best through this webinar to show you the power of what you have at your fingertips to go out there and market your business like no man's business out there. And then that coupled with the experience, and I think this is, again, Adam, that really separates our licensees, because we can literally take people who have had no background in medical billing, take them through that 5 days of live training, and then the next week have them go out there and present this information and get these demos set up. And it's all because we do these demos. You want to explain how we've seen that actually happen with some of our licensees?
Yeah, it happens all the time. We basically run the whole thing, and it kind of goes back to, again, it goes back to the selling thing. A lot of people, I hear this word a lot, convince. A lot of people ask me, how do I convince the doctors to go with me and use my services? You're not trying to convince them of anything. You're doing a needs analysis, and you're uncovering actual things that are going wrong in their practice currently, and you're providing solutions to those problems, by showing them the needs analysis and then showing them the demonstration of the system. And from there, it's like, look, either take it or leave it. It's up to the doctor. If the doctor wants to heal his pain, he or she can choose to do that or not. You're not trying to, shove anything down their throats that they don't need. You know what I mean?
Yeah, and I do some of those. Adam, you've done some of those demos for doctors already, and so we're all on board here to help you get your clients. And it's fun for us, because not only do we get to show you as someone looking to get into the business these demos, but again, we have experience that we've talked to doctors ourselves on for our licensees. And the comments that we hear back when we hear back from these doctors are, number one, wow, I've never seen anything like that. Will this work for my practice? And we get them really engaged, but we get them engaged because of what Adam said just a moment ago. It's because we're doing a very customized demonstration of our system based upon what you have done through the practice analysis. So it's really cool for us to get that practice analysis back, and we say, oh, okay, well, this is a podiatrist, or this is a urologist, or whoever it might be, and then we start to uncover some of their issues. So we get to talk to them like we know what's going on. Oh, we see that you mentioned to whoever that might be as the licensee, you've told this person that you're using this system, you're seeing about this many clients a day. You think that your rejection rate is this, and then we get to take them through that tour as we're going through this demo. Again, very customizable for you. And again, you're not going to find that with the other billing companies. You're not going to find that with the other big boys, the Athena Healths or Cario or anybody else to do that. What separates you from the competition is American Business Systems and the platforms that we have. And that's what makes the one of the biggest differences for you as you help you get your clients. Now, the other thing is, Adam, we get asked a lot, what about doctor references? What happens if I need a doctor reference? And I know that we have this DVD that has some of that in there, but we actually have other doctors that their doctors can actually talk to. Let's talk about just real quickly about references as we kind of start to wrap up today.
Yeah, we've actually created a lot of different marketing materials, and that's another benefit of being an ABS licensee is you actually, the doctors feel like you are a much bigger operation. Even if you're just starting out, even if it may just be you, working from home, the doctors are not going to have any idea that you're a small operation. They're going to know that you're a part of a nationwide network of offices that process thousands of claims every day. So if they're looking for validation of some sort, we've got this DVD that you see here that has a lot of different doctors talking about the services and how happy they are with the services that the licensees are offering. But even more helpful than that is we can actually, in a lot of cases, put the doctors in touch with other doctors that are using the system, and even sometimes the same specialty, just depending on which one it is. But yeah, we can actually let your potential clients talk to current doctors and talk about the system. And they just feel so comfortable after doing that it's such a good thing. We're seeing What are we seeing right now? I think we're seeing close to a 50% or more sign-up rate on doctors that see a demo and talk to
Yeah,
references.
absolutely. It's 50% because it's usually right above that for every two that I know that I end up doing. I usually ends up hearing about that licensee actually getting that doctor as a client. And it may not happen that particular week, but it's going to happen within the next week or two. And we do hear that. And to us, it's very encouraging because we get to demonstrate something to a doctor that is just very, very unique in the marketplace. I had one doctor tell me at one point, it was about a year ago, saying, it's about time someone does something innovative, like having their own clearinghouse built into their billing system. And he says, I cannot believe there's no other system out there that does that except for what you guys are doing. And that is so key. And then, as Adam has said, on top of that, not only do you have the references here on the DVD, you actually have real live doctor references to be able to use. But usually, Adam, I think most of the time after we get through with the demo, the doctors don't even think about having that as a reference anymore. And their next biggest thing is, how can I get started? And I think one of the most encouraging things is that a lot of doctors think, well, this is going to cost me more than what I'm paying now for my current billing. And what's great is right after we get through that demo, now is the time for that licensee to present their proposal that has been helped with our support team. And usually it's always lower than what they've always what they're expected, and usually cheaper than what they're currently doing billing for right now. It really does separate everything out. Now, lastly, and going into next week, we're talking about our training class.
Hey, there's us.
Are you there? Yeah, there we are. There we are. And so here we are teaching the class. We're all up there in the front. And Adam, just real quickly, just talk about the importance of this week of training, because we've had people say, do I have to come down to that live training? Why don't you talk to answer that question real quickly?
Okay, well, if there's any possible way to come to our live class, it's a 5-day class that we do here in the Dallas-Fort Worth area. You're obviously going to get the most latest, greatest, up-to-date information that you can, and it's got a little bit of everything. It's got technical training, it's got a lot of marketing training. It's very upbeat. We keep it interesting. We've got different trainers, as you can see, that come in throughout the week and do different sessions. But yeah, we do those every 6 weeks, and we have people that fly or drive from all over the country to come to the class.
Yeah, and the main person that teaches this class is a licensee of American Business Systems. Cynthia's, you can see her down there at the bottom. She has been around for quite some time. She is incredible whenever it comes into not only teaching, but she has built a solid business. And she's actually a helper on our support team as well for those that might have some help after they get their clients going. So we actually use our ABS licensees as part of our support, not only in the teaching and the training portion of it, but even after you leave training. So we say that this is probably the top-notch training that I've ever been in. I know Patrick and Adam, we all here, I've been to this training at GE, or I've been at this training at this, AT&T or whatever it might be, but this has to be the most solid piece of training that anybody's ever gone through. And I'll tell you why. It's simply because we're helping you learn how to run your business. It's not flashy, it is exciting, but it's not a lot of hoopla. It is hands-on, as you can see here. You're going to get every question that you have answered, and by the day that you walk out of there Friday afternoon, you know what you need to do come that next week on getting that practice analysis done and getting that next demo set up. That's the order of what you need to be thinking about and as you're going through this. Adam, we've got, looks like about 4 more minutes to the top of the hour here, and again, if anybody has any particular questions, it looks like Wilfredo has another question here on, let me see if I can find this. Let's see. Oh, this person. Well, Forever, you must already have some billing experience because they're talking about some things that they find to be very problematic, like HMO healthcare plans are very problematic. And says here that glad to see the system makes it easier. So here we've got someone that's on the webinar today, knows a little bit what's going on in the billing. So you've got a little bit of social proof going on here with someone on here. But Adam, if do you see any other questions here that we can maybe help answer here real quickly?
Yeah, so Eugene was asking, would it be possible to please get a copy of the needs analysis questionnaire? Thanks. Yes, Eugene, just write us a check for $24,990, and we'd be happy. No, I'm kidding. Eugene, just get back with your ABS rep that's been emailing you, and we can probably give you some kind of sneak peek of that needs analysis. It starts out with a series of 20, 25 questions that we give you to ask an office manager or a doctor. So it's very easy. I mean, you have to know very little about this industry because you're just reading off the questions and writing down the answers. And then what you do is you actually take those answers that you're given, and we give you a really fancy spreadsheet that you can plug those numbers into, and it will print a report out that you can take back. And this is part of the proposal that we were talking about. The report will actually show, okay, based on what you told me, it'll have a column A, which is current costs to do billing, and it'll have a column B, which is potential savings by outsourcing to the licensee. So it's very specific, and we teach you exactly how to do that in the training class.
Exactly. Well, it looks like we don't have really any more other questions. Hopefully we've been able to answer all of your questions throughout the webinar today. And so what I'm going to do, I'm going to turn this back over to Adam just real quickly about one of the last things we always like to talk about, and that's the 100% money back guarantee. Adam, I'll turn this over to you, and then we'll kind of wrap up by closing out talking about the next training coming up.
Okay, so I don't know of any other franchise opportunity or business opportunity that allows anyone to completely see behind the curtain and learn everything there is about the business from front to back and offer them a refund. That's what we do. That's how much we believe in the quality of our live training that we do. We will allow you to sit through the entire class, Monday through Friday, and learn everything there is to learn about all the different services. You have 9 different products and services you can offer, what kind of money you can make on each one of those services, how to market them all. And if there's anything that doesn't make sense to you or you just don't feel comfortable for whatever reason, building this business, you can say, I'd like to get my money back, and we will give you 100% of your money back, no questions asked. And that offer is in writing in our agreement. That's how much we believe in the live training. And we've done that, I think maybe 3 or 4 times in the past 15 years or so. There have been people who just decided that the business wasn't right for them, and you know what? Hey, let's give you your money back, and we'll part as friends.
Exactly. You can't lose on that. The only thing that you may be losing is a little bit of your time and a little bit of travel expenses there. But if you're looking to start a business in anything, certainly you have to know whether that company is reputable. And hopefully through the webinars that we do and continue to do on a weekly basis, we build that trust factor with you. Plus you can see what's on the BVB. But really, folks, to really get to know who we are, you need to attend one of our training workshops. And that's why Patrick and Adam have so graciously put this out here for you to ensure that it still is the right business for you even after you sit through the week of training. So please, we certainly just have you to look at that and really, really look at it very, very closely. Adam, we've got training starts next week, and as we start looking at this from this coming Monday, August the 17th is just right around the corner. That'll be about 6 weeks out. So, folks, if you're looking to get started, and it's certainly not too late to get on the bandwagon on what's about to happen with the ICD-10s coming up. So you've got, think about it, August, September, it's going to start October 1, but even if you wait until October or one of the later classes in the year, you still really won't be too far behind because there's going to be so much to do. But those that get involved with the within this type of business before October 1, certainly you have a little bit more of an advantage because you can get some things done prior to that. So I think, Adam, after August, we have maybe one more training before that October date. So folks, certainly be looking at one of these upcoming dates here. Give us a call here at 866-565-8413, and we'd sort of like to talk with you a little bit more, even do a demo for you if we haven't done that for you yet. Adam, thanks so much for taking out your hour of the day. I know that you're a pretty busy guy running the company, and thank you for being on here with us.
Hey, thanks for having me, Eric. And if we didn't get to your question, just get back with your ABS rep, and they'd be happy to help you out.
Absolutely. Thanks so much, everybody. I hope to see you, if not next week, on our webinar, on maybe one of the other company webinars coming up, or the August workshop. Thanks so much, everybody. Have a great day.
Thanks.
See you, bud. Sure. Bye-bye.